first-hand impacts of a climate-driven storm has further ignited my passion to be a voice in the climate change and health arena. I thought applying for this fellowship program would provide me with the knowledge I needed to solidify my experience. However, I am happy to say that this fellowship has done far more than that. The fellowship has given me a greater appreciation for the interconnectedness of climate change. The beauty of the fellowship is that it encompasses a cadre of professionals with one common goal of improving leadership in climate change around the region. The importance of networking, breaking down silos, and most importantly, intersectoral collaboration was achieved among fellows through our weekly discourse with experts on various subject matters. Over the past year, as a result of the connections made through the fellowship, I have given remarks at regional climate change forums, played a role in the human interest story about the impacts of climate change on mental health and the overall affairs related to climate change in the region, gave a lecture on hurricanes at the Climate Change and Health Responders course, which is spearheaded by the Global Consortium on Climate Change and Health Education, Columbia University, Earth Medic, Earth Nurse, and the Caribbean Institute of Meteorology. Special thanks to Dr. James Hospitalis for that invitation. Have been asked to chair 2 groups at the Ministry of Health and Wellness in the Bahamas on climate change and health, focused on leadership and mentorship for physician groups. I was selected as the 2022 Global Youth Climate Network Ambassador for the Bahamas, and through this platform, I intend to focus some of my efforts on educating our youth on climate change matters. Speaking of youth, today actually closes the entries for the Youth Video Climate Change competition that I have initiated through this fellowship, and I want to publicly thank all of my sponsors. Currently, I am also in discussion with the University of the West Indies School of Clinical Medicine and Research in the Bahamas for implementation of climate change and health modules within their curriculum for medical students. I've had the opportunity to spend a week at the Caribbean Disaster Emergency Management Agency, where I was able to get an in-depth appreciation of what CDEMA is all about from the Executive Director, Ms. Liz Riley, and her team. While in Barbados, I had the opportunity to visit with the principal of CIMH, Dr. David Farrell, and also Ms. Carrie Hines, who is the Director of the Department of Emergency Management, Mrs. Donna Giddens and Jose Lagara from the European Union as well. 2 of the main deliverables of the fellowship, I have had the opportunity to do a conference where I educated, sensitized, and raised awareness to disaster preparedness in the era of climate change. And last but not least, conducted a research project focused on assessing disaster preparedness, education, and training in healthcare workers. It has been quite a busy year, to say the least. I could not put a price on the knowledge and skills learned over the year. When counseling patients, I now spend time speaking to them on climate change and the impacts that it has on health. I continue to work with the climate change team at the ministry as we work on various projects of national importance, such as our Health National Adaptation Plan. I have definitely grown professionally and will continue to use what I have learned to be an asset to my community, country, and region at large. To Stacy, Craig, Chris, Steve, Shanika, Kim, Stephanie, and Kenzie, I say thank you, and let us continue to work together to build climate change leadership in the region.